Do you often notice that your legs feel heavy, swollen, or tight, especially in the morning or after standing for long? Imagine putting on your shoes and realizing they feel too tight, even though your weight hasn't changed. This could be a clue that your body isn't draining fluid properly. That's where primary lymphedema, also called Milroy's disease, comes in. It's a rare condition you're born with, where the lymphatic system, your body's drainage pipes, doesn't work right from the start. Think of it like a sink with a clogged drain, water, or in your body. Fluid builds up because it can't flow out. Most people notice swelling in their legs or feet early in life, sometimes even at birth. It's not common, but if someone in your family had lifelong swelling in their legs, this might be why. So why does this happen? Imagine your lymphatic system is like a network of tiny straws that carry waste and extra fluid away from your tissues. In Milroy's disease, those straws are either missing, too narrow, or not formed correctly, and that's all because of your genes. Specifically, a faulty gene called FLT4 is usually to blame. This gene helps build the lymphatic pipes before you're born. If you inherit a broken copy from a parent, your drainage system stays weak. It's like getting a house with poor plumbing from day one. Even though you did nothing wrong, the system just doesn't work well. And because it's genetic, it can run in families, though not everyone with the gene will show symptoms. Now, how do you know if it's Milroy's disease? Let's play detective. The biggest clue is swelling, usually in both feet or lower legs, and it doesn't go away overnight. Press your thumb on the swollen area. If it leaves a dent, like pressing into a sponge, that's called pitting edema, a common sign. The skin might feel tight, and socks leave deep marks. Some babies are born with puffy legs. Parents might notice their baby's shoes or booties don't fit. Over time, the skin can get thicker, harder, or even develop warts or infections. Here's a real-life sign. If your child gets frequent cellulitis, skin infections, in their legs with no clear reason, it might be linked to fluid buildup from poor lymph flow. No pain, that's normal. Swelling without injury or heart issues is a red flag. First, they ask, is the swelling only in the legs? Did it start at birth or in infancy? And does anyone else in the family have it? Then, they may order a special scan called lymphoscintigraphy, where a tiny bit of harmless dye is injected into the foot to watch how, or if it moves through the lymph system. Like tracking traffic on a highway, if the dye doesn't move, the roads are blocked. There's no cure, but treatment helps control symptoms. Methods include wearing special compression socks, like firm, supportive leggings, to push fluid out, doing gentle leg exercises to pump fluid, and keeping skin clean to avoid infections. Manual lymph drainage, a light massage done by a therapist, helps move fluid. Think of it like gently squeezing a sponge to help it drain. Early care prevents long-term issues. Since Milroy's disease is genetic, you can't avoid being born with it. But you can prevent complications. Think of it like owning an old car with a weak engine. You can't change the engine, but good care keeps it running. Here's how: protect legs from cuts and burns. Use gloves while gardening. Moisturize skin daily to prevent cracks. Avoid tight clothing or socks with tight bands. And never ignore swelling or redness. It could be infection. If you have a family history, see a lymphedema specialist early, even if you feel fine. Simple daily habits, like elevating legs while sitting and staying active, go a long way. Awareness is prevention. Scientists aren't giving up. Recent research is exploring gene therapy. Imagine fixing the broken FLT4 gene before birth or in babies. In labs, researchers are growing lymphatic cells and testing drugs to help them grow better. Some trials are testing VEGFC, a protein that encourages new lymph vessels to form, like building detours around a roadblock. Another exciting area is wearable tech, smart socks that detect swelling early by measuring leg size. Early detection means earlier care. While these aren't available to everyone yet, They give hope that one day, treatment could be more than managing symptoms.